When I spoke last, I mentioned that the Obama administration proposed to spend about $630 billion to expand healthcare coverage and reduce healthcare costs. That's great, but you need to go from a press release to legislation. So for the details I needed, I went to the Congressional Budget Office, the CBO, and got specific recommendations on how to increase healthcare coverage for the approximately 45 to 47 million Americans who don't currently have it, and how to reduce costs for all of us. To increase coverage, you have a range of options. There's a healthcare insurance exchange, where all sorts of different insurance companies can sell their wares. This encourages the consumer to buy insurance because it's easier to buy, it's in one location, and coverage requirements are standardized. There probably will be a public insurance option available in addition to the private insurance options, so keep in mind that the public insurance option is always going to have the taxpayer to fall back on, and the private insurance carrier won't. Other options include requiring insurance companies to offer insurance to all comers, regardless of pre-existing conditions. You can require large companies, that would be Walmart, to offer insurance. You can create subsidies for low-income individuals, but I'm not going to get into the crowding out effect or the buying out the base just yet. And of course, you can just pass a law that says everybody has to have coverage. To reduce costs, you also have a range of options. You can change incentives. Right now, Medicare is paid for on a fee per service that encourages lots of services. You can change that to a fee per patient, or maybe even fee per success. You can also tinker with the tax code. Right now, there's an open-ended exclusion on medical benefits, insurance benefits, and it really encourages the well-off to get the most Cadillac, most gold-plated of insurance benefits, which in turn encourages the most Cadillac, most gold-plated of medical procedures. There's also comparative effectiveness research, which could end up with the government telling us the most efficient procedure to use for a particular condition. So with that said, there's a problem with this. And the problem is that it is generally easier to expand coverage, because you know the taxpayer is going to pay for that, than it is to reduce costs. Now, there are some practical reasons for this. For example, many cost savings procedures are oftentimes phased in to make a more smooth transition. Sometimes it costs money to save money. Take cancer screenings or incentive payments to doctors to use electronic health records. But even the CBO admits the biggest component of cost increases is new technology, new developments, advancements in medical treatment. So to save money, we're going to limit access to those new treatments. If Granny has pneumonia, we're going to say, gee, it's too expensive for you. That'll never happen. So what I think is going to take place is a substantial increase in coverage, but a huge increase in costs.